Hello, how are you doing? My name is Neil O'Grady, osteopath, and today I'm going to explain to you landmarking of the lumbar spine and pelvis. I'm going to use a skeleton here where all the bony landmarks are visible, and I go through the anterior, posterior and side-lying aspects of it. So to start off in a supine position, I will start with the ASIS, which is the anterior superior iliac spine. I'll place my thumbs on the ASIS. Those are easily palpable in most people unless they have a lot of adipose tissue. I start here, and I like to use the analogy of a protractor. So I have a point of reference and I'll move the fingers around it, and I'll always have a point of reference. So I start here and I'll work up like this onto the iliac crest. And that's the highest point here, okay? And I'll just bring my fingers in and you'll press in through the sort of adipose tissue on the body and you'll feel the iliac crest. And I'll work anterior slightly and bring my fingers around, and here you'll feel the iliac tubercle. That's, if you see there, it's kind of a little bit thicker. It's an attachment point, and that's the widest part of the pelvis. As I'm here, just as a point of information, here is the AIS, anterior inferior iliac spine. That isn't that easily palpable on most people unless they're very extremely lean and not even carrying a lot of muscle. That's an attachment point for the rectus femoris, so the central quad and knee extensor and hip flexor. So I'm here and I'll work from here like the protractor out onto the greater trochanter. So I'm on the greater trochanter. Now that's my point of reference, okay? So the greater trochanter is the widest part here. That's just off the neck of the femur. It's an attachment point for the glutes, and that's my point of reference here. And now the thumbs are going to lift off, and I'm going to come off the greater trochanter and onto the inguinal crease. When you're working on the inguinal crease, make sure that you have permission from the person you're working on, and make sure they push the genitalia out of the way or cover the genitalia. And from here, from the greater trochanter, I'll work along the inguinal crease and I can work inwards onto the pubic tubercle. This can be an issue with osteitis pubis or pubic symphysis disorder. You might find in this that one of the pubic tubercles is a little bit anterior or posterior, or it's a little bit superior or inferior, and it could be a tender point or a source of pain. Okay, so next I'm going to side lie my patient. So, and I place him in the recovery position, okay, like so. Okay, so what I'm looking at here, I'm starting at the PSIS, which is the posterior superior iliac spine. So that's like the bony protuberances here. If you're looking at someone from the rear, they can be just below the two dimples in the low back. So I'm here, I'm really just looking at the uppermost side here. And again, like the protractor, I'm coming off the PSIS, I'm working down onto the greater trochanter. Quite easy to find here because everything else is soft around it. And this is the hard bit that sticks up. It doesn't have much padding on it, okay? This interesting one here is called the doorbell test. Press the thumb in when they're either lying supine, prone, or even here. If you press on the greater trochanter and they have greater trochanteric bursitis, this will hurt. They'll kind of wince and probably pull away, okay? So I've gone from the PSIS onto the trochanter, and then I'll swing down again. My trochanter is my point of reference onto the ischial tuberosity, the attachment point for the hamstrings. And that's the bone that you sit on. You press up into the gluteal fold and up here, and you'll feel that hard end feel there of the ischial tuberosity. And why we're in this position is because, let's say we want to palpate the sciatic nerve. The sciatic nerve is halfway between these 2 points approximately. So it runs through here. So it comes through the sciatic nerve, sciatic notch here, and down through here, okay? It has contributions from L3, 4, L5, S1 and S2. And it runs down here, down the back of the leg. Okay, so now I'm going to move the patient into a prone position, and I'm going to palpate some more areas on the iliac crest and at the PSIS. So normally when you're treating someone and they're lying face down, you want to find out your points of reference, and you want to know where, would say for example, L5 is and where everything in relation to that is. So usually if someone's prone, I'll get to the iliac crest, I'll push my hands in, I know I'm on the iliac crest, and if I drop my thumbs in a straight line across here, I'm on the L5 interspace, L4, L5 interspace approximately. So I'm in here. So I just come down maybe 0.5 centimetre and out, and I know then I'm on the L5 transverse processes, okay? And I can, from there, I can work my way up, okay? Assessing for restrictions throughout the spine, okay? You can work all the way up to T12. You can go 5, 4, 3, 2, 1. Some people palpate, they'll feel where the 12th rib is and work in off the 12th rib, and that's T12. Or you can work up from the bottom. So that's L4, L5 interspace is a straight line along from the iliac crest across. And if I want to find S2 here, I look at the PSIS here, posterior superior iliac spine, and draw a straight line across, and that's level approximately with S2. Okay, and that's landmarking of the bony landmarking of the pelvis and lumbar spine.